medical receipt, but you're not speaking.
Yeah, I'm not using that. Are all the members of the media here? Okay. I'm actually going to leave you for 2 minutes while we start. I have to go and do what you can't do for me. But since we are running against the clock and people having to take flights, I am starting, and I would like, first and foremost, to welcome you and to thank you for your patience today. This has been a critical meeting for the Caribbean community and its stakeholders, in particular in this press briefing. Can I ask Dr. St. John also to come up to the head table from CARICOM, please? But we also have in this press briefing the Secretary General of CARICOM, the Chairman of COSOD, Minister Marvin Joseph from Antigua, the Assistant Secretary General of CARICOM, who has responsibility for these matters, Mr. Slater, the Director of CARFO, who is joining us at the head table, Dr. Joyce St. John, Mr. Arnold Donald, who is the CEO of Carnival Cruise Lines. That's correct. Corporation. Carnival Corporation. Full stop. The overall corporation. And Dr. Etienne from PAHO, the Pan American Health Organization. And this, therefore, is a press conference with a difference because she is joining us by Zoom from Washington, D.C. And to that extent, therefore, since we have stated from the outset that this region will always first and foremost be guided by the medical and scientific evidence, we believe that it is important to have Dr. Etienne as the head of Pan American Health Organization give us an updated status as to the circumstances surrounding COVID-19 and the extent to which there is or ought to be concern or not. Dr. Etienne, please. Thank you.
We can't hear Dr. Etienne. Audio?
Oh, no, it's coming up.
Yes. Our audio is on. Is that okay now?
We're hearing you now.
Okay, good. Thank you, Honorable Prime Minister, and it is well appreciated, this opportunity to share some of the epidemiological background information. As to this morning, the 1st of March 2020, globally there were 86,933 confirmed cases of COVID-19 with 2,977 deaths. There are 60 countries that have reported cases. 5 new countries up to this morning were reporting cases: Monaco, Azerbaijan, Qatar, and Ireland. In the region of the Americas, we have cases in the United States of America and Canada. There were 2 cases reported in Brazil. We now have 6 cases in Ecuador, 3 cases in the Dominican Republic, 4 cases in Mexico, 2 cases in St. Martin, and 1 case in St. Bat. Many of our the cases are related to the outbreak in Italy.
Either a T-Pawn or Richard.
As of Friday, WHO has upgraded the risk levels for all countries as very high. WHO has fallen short of naming this outbreak a pandemic, but it is expected that very soon there will be a naming of the pandemic. The outlook for the CARICOM region, therefore, there is a high likelihood that we will see cases in this sub-region. It's already here. We have cases in St. Martin. WHO does have great concern for the situation in some countries, particularly those countries with weak health systems. There is significant useful information that has come based on the mission that went to China. It seems that some 80% of the infections were mild. 14% of the infections were considered to be severe, and 5% very severe requiring ICU and ventilation. The duration of illness, for mild illnesses, generally about 2 weeks. For severe illnesses, some 3 to 6 weeks, requiring some of them intensive care and ventilation for a period of time up to 40 days. The age group affected, in the age group less than 19 years, we've seen that the disease is very mild and infrequent. Only about 2.4% of children under 19 were reflected in the number of cases. For the case fatality rate, it depends on the intensity and the capacity to manage, but the case fatality rate in Wuhan province was 5.8%, and in the rest of China, 0.7%. For cases less than 8 years, for a majority of the cases, we've noted that it has been worse for persons with underlying conditions, cardiovascular, diabetes, hypertension, chronic respiratory diseases. And the age group most affected is the age group over 80 years. And generally, there were more males infected than females. It is important that we note that in the Caribbean, that the several countries have the capacity to test for COVID-19. These include Suriname, Guyana, Trinidad and Tobago, Barbados, Dominica, Jamaica, Belize, Bahamas, and Haiti. Also Martinique and French Guyana, Curacao and Aruba and St. Martin, and the British territories of Cayman and Bermuda. Our work in the region as PAHO is to strengthen member states' capacity to detect, to contain, and to manage cases. We believe that there is some capacity in the region, but there is work that is necessary to ensure maximum capacity in the Caribbean region. Over.
Thank you very much. At this stage, I would like to invite the CEO of Carnival Corporation. Earlier today, we would have had representatives of the leadership of the cruise industry, Carnival Corporation, MSC, Norwegian Lines, and on Zoom, also Royal Caribbean. We also had the Prime Minister of Jamaica, Prime Minister of Bahamas, President of Haiti, the Deputy Prime Minister of St. Kitts and Nevis, also online, along with ministers from BVI and Montserrat, correct, SG? Oh, I said them already. And with us present today were ministers from Trinidad and Tobago, from Suriname, and we also had Minister from Grenada and Minister, obviously, who is chairing COSOD from Antigua, Minister Joseph, who will speak shortly as well. And we had as well Prime Minister Chasney and Prime Minister Skerritt from St. Lucia and Dominica. So that we've tried to have a relatively wide sample of all stakeholders in the region, given the fact that this matter is an urgent matter for us and that we need to have clarity and certainty. As I indicated, these are uncertain times not only for the Caribbean community, but for the entire world. And the only way uncertain times can be appropriately overcome is through collective leadership, foresight, and partnership. And it is against that background, therefore, I have identified for you the persons who were present today as we sought to come to a regional protocol establishing minimum standards for dealing with specifically the COVID-19 virus, but generally all infectious diseases with respect to our borders, our travel partners, and today we met primarily with the cruise industry, but we will also later in the month of March be meeting, I believe, on the 13th of March with the airline industry. I'd like at this stage, therefore, to invite our good friend Arnold Donald, CEO of Carnival Corporation, to address the media. Thank you.
Thank you. Hello, everyone. First of all, I want to thank all of those that attended and participated today, whether in person or via Zoom, and a heartfelt thank you to the Honorable Mia Motley for her leadership, convening all of us together, and then skillfully navigating a rather lengthy meeting to reach some good and important alignment. Our highest responsibility at Carnival Corporation, and therefore our top priorities, are always excellence in safety, whether that's marine safety or health safety, environmental protection, and compliance. And those are our highest responsibilities and our top priorities. And I'm sure a number of the others in our industry share that. So today, discussing this was very important to us. We have, and the industry does, a number of screening procedures and protocols for prevention, surveillance, and response. They're integral to our industry operations because we have to do this all the time. Through the years, there have been a number of disease issues and scares around the world. To name a few: Zika, Ebola, MERS, SARS. We have to deal with isolated things because in our case, we go to over 700 ports a year, and there's always something going on somewhere. We've dealt with issues here in the Caribbean even. And so these protocols that we have in place tend to serve us well. And of course, we fine-tune them, as we have in this case, for the specific disease or illness situation that arises, and in this case, it's COVID-19. I think for us, it was important to be here, to participate, to encourage everyone to align with the guidance and procedures from the World Health Organization and other global medical experts, so we have a common basis for which we can operate and continue to provide opportunities for the economies while keeping our crew, our guests, and the locals that we come in contact with as we bring our guests to places here throughout the Caribbean healthy and safe. So I just again want to thank the Honorable Mia Motley, everyone for giving us the opportunity to participate, and we certainly look forward as Carnival Corporation, but also the entire cruise industry, and working with each nation, each territory, to arrive at what's going to work best for them and their citizens. So thank you.
Thank you very much. One of the key aspects of concern for the meeting was not only to define the responsibilities and obligations of individual partners, whether it is member states, the cruise industry, the public health officials, but it was also for us to address the issue of capacity. I think we have heard from Dr. Etienne and others who spoke, Carfa in particular today, and I'll ask Carfa to speak, to give us background, because it is likely that there is no part of the world that will be spared. But having said that, having listened to the science and the expressions from PAHO and CARFA, it is clear that it is entirely within our capacity to manage and to contain. And once we can detect, contain, and manage, then in the same way that we as small island states, whether it's SARS, H1N1, the influenza, before Ebola, chikungunya, Zika, we can manage this as well. But it is going to require cooperation, partnership, discipline, and communication in order for us to detect, manage, and contain, and manage the process. Dr. St. John?
Thank you very much, Chairman of Conference, and I want to thank you again for your leadership and for achieving what I thought was a Herculean task. I really feel that a lot of trust was built. I really feel that we have gone a long way towards regional solidarity, not just the sub-region of CARICOM, but also with the representation of PAHO and the support, the region of the Americas solidarity. The whole mission is to minimize death and illness. And I really appreciate the agreements that were reached, especially with the cruise industry. We have focused quite a bit on border control, and there is a very important role that the cruise industry has to play in helping us with border control while we remain open for tourism business. But there is also the need to pull back in and also focus on preparing for importation and transmission. And you know that CARFA raised the risk level, and that was before we had cases in the non-English speaking Caribbean, but there are cases in the Caribbean. So thank you very much, Prime Minister, for what you have been able to achieve in terms of solidarity.
Thank you very much, Dr. St. John. As a result of the conversation, one of the things that we did was to establish a framework for an expanded Bureau of Heads of Government to be able to immediately work to see how we can marshal the resources that will be necessary, whether from our partners in the travel and tourism industry, from our partners in the international financial institutions or regional financial institutions, or our local and regional private sector, in order to be able to increase our capacity to contain and manage any outbreak, given the fact that, according to Dr. Etienne and PAHO, the chances of us finding severe cases are really 1 in 5. And even then, of those, the numbers of persons going into ICU are really very limited and more likely to be persons who are either over 80 or who have serious underlying conditions of a chronic nature. Against that background, the subcommittee of the Bureau, expanded Bureau, so it will be Barbados, St. Vincent, St. Lucia, and Antigua, will start work immediately to see how, in partnership with CARFA and PAHO, we can work with these stakeholders to see how we can marshal the resources necessary to immediately meet our concerns nationally, regionally, and with our partners, particularly in the case of the cruise industry. Those of us that are home porting have particularly different responsibilities from those who are just a cruise destination. Against that background, we felt that it was important for individual member states to all ensure that we have our response mechanisms, our emergency response mechanisms in place. And I'd like to ask the chairman of COSOD, Minister Joseph, to be able to address those issues and how member states will go forward, recognizing that we not only face the public health outbreak, but we are 3 months from the beginning of the dreaded word, the hurricane season.
Thank you very much, Prime Minister. Let me clearly state that my satisfaction in the manner in which this exchange was managed today. I think that we have made significant progress in the communication between the cruise industry and the several states in CARICOM. I'm particularly pleased with the commitment of the cruise industry to maintain a clear line of communication and to ensure that one critical aspect of managing this risk and that is to ensure that pre-boarding screening is done in a very extensive and effective way. This type of information will assist not only tourism but the ministries of health to be able to make speedy decisions that will not delay the execution of the ships entering the port and departing as well. We want to recognize the important role of PAHO in this process. And the demonstration, for instance, of PAHO's support for the different states in the CARICOM are critical in terms of us building capacity and being able to play a role in ensuring we create a balance between the needs of protecting our people's health and ensuring that we continue to grow this vital industry in the region. I would like to also recognize the important role of SEDIMA, CARICOM and IMPAS, and CARFA. These institutions in the Caribbean are very important to us. And at this meeting, it clearly demonstrates that in terms of capacity, these regional institutions are making tremendous contribution in strengthening the capacity of the region. I want to, Mr. Donald, say that your presence here is very encouraging in light of the fact that I think you had to defer your departure to stay. And that is a clear demonstration of your commitment to ensuring that we collaborate, we cooperate to get a balance in our concerns. The fact is that we have moved now from a state where we are mitigating to a state where we are adapting in the Caribbean. And that means that the Caribbean must build capacity in the reality that one day we'll have to manage a case of COVID-19. As was stated before, it's not if, it's when. And insofar as this meeting is concerned, I am confident that the capacity building is going to be realized with the support of the different institutions, PAHO, CARFA, SEDIMA, CARICOM, and IMPAS. Madam Prime Minister, let me say once again, I really appreciate the way manner in which this was managed, and we can now look forward to building on the achievements of today.
Thank you very much, Minister Joseph. May I say to members that our ability to scale up surveillance at our ports of entry, identify quarantine and isolation facilities, enhance the training of our frontline staff, and strengthening laboratory capacity within the country is really at the center of what we mean when we talk about building capacity. Against that background, we will continue to be guided by the science and the medical officials in this matter so that we can at all times protect the health of our citizens and all visiting our territories, while at the same time protect the economic stability of our region and our countries, given the fact that panic and fear can have a greater deleterious impact, a greater negative impact on our countries than in fact the epidemic of COVID-19 itself. I'd like also, therefore, to use this opportunity to share with you that against that background, the government of Barbados has also, in our attempt to be able to better detect, contain, and manage, we have identified the old Naval Base facility at Harrison's Point, which is well known to Barbadians for other purposes that were used, regrettably, some time ago, to be able to identify the costs involved in bringing parts of it back in to functional operation. I visited the site yesterday with the Minister of Health, the Attorney General, the Minister in the Ministry of Public Works, Peter Phillips, as well as the Minister of Foreign Affairs. We had MTW clear all of the bush because regrettably it has become overgrown. All of the windows and doors, conduit, wires, everything lifted out, but the buildings are in good shape. And that's the important thing that will allow us to move quickly. And it is against that background, therefore, that so long as we can identify the requisite resources, we will, on a building by building by building basis, start to increase our capacity even beyond the 80 to 100 that I spoke to you about on Thursday in the press conference, because we are cognizant that as a home port, we also have to be able to contain and to be able to allow persons, in the event that there is a problem, to be able to move quickly. It is against this background that the government of Barbados will keep in regular contact with the people, because we believe that nature abhors a vacuum, and that the most important thing is that people have clarity as to what is happening, clarity as to who has what responsibility, clarity as to whose decisions they are to make in the various aspects of what we're doing. This is not a simple issue for us because we are in an IMF program, and therefore we need to be able to treat to those intervening extraordinary events in the manner in which others will do so. And at this stage, therefore, we are keeping the country up to date as to where we are going. And I want to thank the members of the social partnership, members of the labor movement, members of the private sector and their leadership for being here today in these discussions as part of the Barbados delegation. This is not an easy moment for any of us. And because we are living in a world where in the last decade alone, air travel has virtually doubled, because we are living in a world where communication between people is as easy as picking up this phone and using it, it means that we are fighting new forces in our ability to detect, contain, and manage any public health outbreak, not just this one. And to that extent, because of the rise of fake news in the last decade as well, it is absolutely important that people only seek and receive their information from credible sources, credible, established sources, either nationally, regionally, or internationally. And I want to ask the public of the Caribbean to work with us in that respect, because you will not catch this by going into a building that somebody went into. You will not catch COVID-19 by standing 10 feet or 15 feet away from somebody. And I'm asking that we have across the region and across social media regional public service announcements that will allow ordinary people to better understand and appreciate how to take care of yourself. We've already said wash your hands regularly. That you should be doing anyhow before COVID-19. We've already said try not to touch your face. Well, for those of us who interact a lot in public, we had red eye before we had COVID-19, so you should also not be touching your face regularly. We've also said to be able to manage your environment properly. In some countries, mosquito-borne diseases pose a greater likelihood of problems for our people than COVID-19. So we need to contextualize this, and we need to recognize that the one thing we cannot do is to start to attack nationalities or countries, or to get a level of xenophobia and to close off borders and to create barriers that will in fact lead to loss of jobs, loss of economic activity, greater social implosion, greater opportunities for crime, and all of the other things which are equally public health disorders. So I ask us, please, to bear in mind that we are going to communicate with you. We don't know whether a vaccine will come in 12 months, 15 months. We don't know. But what we do know is that we are setting out clear boundaries and responsibilities for individual partners, and that we are going to try to increase our capacity to detect, increase our capacity to manage, increase our capacity to contain. And we are happy that the cruise lines have also agreed that where possible, they will also work to facilitate the taking of samples so that we can reduce the time taken in order for any testing to be done. I think it is only fair that we place in context too, that if Carnival, for example, says that they have about 250,000 people traveling every week, and there has not been a single case within the region on a cruise vessel, we have to be thankful for that, and we pray that we can continue to be thankful through enhanced measures on both of our parts in that respect. We have also to do the same for cargo vessels and airlines, and we intend to do so as we go forward. I'd like to also therefore thank those ministers, those prime ministers, those who are still online, the Director General of PAHO and all of her staff, of CARFA and her staff, of SEDIMA and his staff, of IMPACTS and his staff, and of course the CARICOM Secretariat. The Secretary General had to take his leave to return to Georgetown. As you know, we have elections in Georgetown tomorrow, and therefore we are truly as a region having to walk and chew. But we can walk, chew, dance, somersault, and do many other things together. So I have every confidence that we, the people of this region, as our others before us have risen to the occasion, that on this occasion we shall rise to it, and you shall hear us regularly, not because we want our voices to be heard, but because nature abhors a vacuum, and it is important that the people of this region can get about their ordinary lives while allowing us to take the actions to contain the spread and to ensure we manage effectively those who are affected by it and infected by it. Any questions, please, for any of us?
Elaborate on what, if any, agreements were made in terms of regularization today. What can you tell us?
As I said, we basically settled, and you'll have the communique, a regional protocol that establishes minimum standards as to what we expect from the cruise industry, what we expect from our own member states. The extent to which one member state may differ from another will be collated and supplied to the cruise industry by no later than Tuesday evening by CARFA. CARFA, for those who don't know, is the Caribbean Public Health Agency. And similarly, we've created a subcommittee of the Bureau in order to be able to start the discussions with our regional and international partners. And against that background, we have asked both PAHO and CARFA to help us in the identification of the gaps that exist within our respective member states, so that as we move to marshal resources, we will be in a position to help. We recognize that instead of every country having the same level, it may well be the identification of a few countries within the region because of what is involved. And to that extent, in the same way that Barbados has identified, other countries will also be looking to expand hospital capacity and capacity, particularly for quarantining and isolating cases. Okay? I think that captures it. Did I miss out anything? Thank you. I should say that the cruise lines currently test for influenza A. What was made clear to us is that they would not be in a position to test for COVID-19 because there is not yet a rapid test available. So for those who may be asking that question at home, I decided to answer it up front. But when such a test is available, then obviously it will make everyone's lives easier in the same way that when a vaccine is available, it will make everyone's life easier. Yes, ma'am.
Okay. Prime Minister, you mentioned the naval base in St. Lucie. Can you tell us exactly what you're planning to do there? You said you're increasing your capacity. Is that you're using that as a quarantine area?
Be looking there to use both for quarantine and isolation. Luckily, we have a number of buildings that will allow us to be able to deal with quarantining. And previously, when it was used as the temporary prison, there was also a temporary hospital provided there. So we have a building that we will have to bring back into shape. It's a couple weeks' work to do all of it, but luckily the engineering of the walls and the flat roofs. In fact, let me say that whether it is public health outbreak, whether it is hurricane or other natural or man-made disaster, I am now satisfied that each country in the region needs some kind of facility that allows us to be able to retreat in times of emergency in order to be able to sustain the state or to allow the state to contain a situation that is otherwise uncontainable. And I regret a country should not have to spend money twice within 20 years on the same thing. But regrettably, what we saw there yesterday was a decade or more of absolute and utter neglect, with bush and trees 15 feet high, 20 feet high, and as I said, most of the buildings stripped. But fortunately, the walls are in good shape, and therefore we believe we can do some quick work on that. In the interim, we do have capacity, as I identified to the country on Thursday, okay, at Elaine's Canterbury Centre, the old district hospital, which is actually currently under repair now, Minister Bostic has advised, and also Paragon and the BDF's military hospital, which is second to none, which can hold quite a few people.
I understand it will be early days, but you have a guesstimate perhaps of how much that work is going to cost?
Absolutely not. I'm not even going to try. The Ministry of Health has now to engage officials. We're going to need a separate project manager, because the truth is, the one thing you do not do in a crisis is to delude yourself by believing that you can shift resources from existing capacity to new one, because what you end up doing is creating a problem with your existing obligations. So I've given instructions that they are to be able to invite the quotations for project management, and then let them go immediately to invite quotations from those who have the capacity to act fast and to act competently as well.
Prime Minister, if there is a need for that building to be used, what is the patient capacity for it? Can you say it?
I can't tell you the capacity from the point of view of the hospital, but suffice it to say that the building is probably almost as big as this room, so it can hold quite a bit for the isolation and for the quarantine. There are a number of buildings, but the immediate building we're looking at for the quarantine has the capacity probably to hold collectively, Jeffrey, what, 150, 160 people minimum? There? About that. Okay? And that one would be quarantine. The one that is the hospital for isolation would be obviously slightly less. And you would only be transferring people to isolation if they tested positive or developed the symptoms that would lead to them having to be tested, and those tests are available to give us results within 4 hours. I really want to commend the Barbados Medical Establishment too, because all the talk, the immigration, the customs, the port workers, and the doctors and nurses that are on the front line of keeping this country safe. And without them, we could not be here today even talking. So I really, really, really want to commend all of those officials on the port, the airport, immigration, customs, the port workers of at all levels, in particular the mooring gang, and of course the nurses, doctors, ambulance drivers, etc. Everybody has really pulled weight, and I want to say we will only get out of this if each one of us pulls our own weight. If there was a risk, I would not have gone on the ship. If there was a risk, I would not be putting others in harm's way. So I want us to know, however, that the greatest risk is fear and panic, and I mean that sincerely.
Prime Minister, in terms of the countries that are actively involved in home porting, are each of these countries in a position now where they will each do the same thing in terms of when ships are coming in and there may be a need for testing? Each
country has now to do their own analysis. That's why you heard me say earlier that we're asking PAHO and CARFA to help us with a gap analysis so that when we go now to talk to the regional and international financial institutions and our stakeholders in the private sector, that we can sensibly put together something that is not full of bells and whistles, but that is designed to take care and to stabilize what is the immediate situation. You know, if there is an appropriate vaccination in 6 to 9 months, we'll look back on this as we look back at SARS, at H1N1, at all of them. I mean, there was a point at which, with chikungunya, I still carry the scars well of chikungunya, because for 2-3 years, your joints were affected. But there was a point at which, in the September of that outbreak, the National Insurance Scheme of Barbados was inundated with claims, if you recall, sick claims from both public and private sector. So these things happen in life. Any more questions? If none, thank you very much. I really, really want to thank everyone. I am aware that this is a Sunday. I'm aware that these are unusual times, but I'm equally aware that the only way we are going to solve this problem is by working cooperatively, working with a common mission, and making sure that where there are those who are not yet on board or who disagree, that we find a bridge to be able to ensure that there is constant communication, because there's nothing that says that we will always agree on everything. But we do have to agree to keep the conversation going with ourselves, with our regional public, our populations, and to ensure that, as Dr. Etienne put it so appropriately at the beginning, that we have at all times the capacity to detect, contain, and manage this particular outbreak. Today, it is COVID-19. In the past, it was something else. Let us make sure that as we build this capacity this time, that we're not having to do it from scratch at any time in the future. Thank you, and God bless you, and God bless this region. Thank you.